BC's Minister of Health. Before we begin, I'd like to recognize that we're gathered on the territories of the Kwantlen, of the Katzie, of the Coquitlam, of the Kakite, Semiahmoo First Nations, and on the treaty lands of the Tsawwassen First Nations. We're honored to be here today on their lands, and it's great to be back in Surrey today, where we're sitting and back from here will be the sites of the new cardiac cath lab, which is much discussed, in Surrey. And we'll have an opportunity for people who have their cameras here to see the area that's also been cleared out, which was previously an administrative area, which will be for the cardiac cath lab and the new interventional radiology suite here at Surrey Memorial Hospital. This is on top of course, the announcement we made last week. If you're looking out from Surrey Memorial, from the administrative offices, when we take you there, you'll see to your right the site of the new renal center here at Surrey Memorial Hospital, which we announced the business plan approval last week. You move to your left, you'll see where the new tower will be at Surrey Memorial Hospital. Very significant things are happening, especially in specialist care, and we'll talk about more of those in this announcement. But this is where we are, this is where it's happening in the hospital, and it's, to say the least, a very exciting thing for the people of Surrey who have advocated so strongly for those things. What I'm doing today is bringing an update, which I have been consistently, on 30 actions we've taken to make improvements here at Surrey Memorial Hospital. Those actions were, of course, started and set off after working with healthcare workers, with health sciences professionals, with nurses, with doctors here at Surrey Memorial Hospital. We made the decision to take a series of actions, which I announced last year. Those actions there have been progress on every single one of that 30-point plan, and it reflects the challenges of the city of Surrey, the extraordinary population growth that's occurred here, of course, in the past and was not recognized by previous governments, and the extraordinary population growth that we're seeing now. Approximately, for example, 2,000 more people a month, every month here in Surrey. And it reflects a broader situation in the province. As you know, we've added 550,000 people to MSP in the last 3 years. To put that in context, at a time of lower economic growth more than 10 years ago, that number was 120,000 over 3 years. In other words, that population growth is 4.5 times what it was at that time. And that means more broken legs and more diagnoses and of disease, more emergency room visits, more ambulance visits. And we've responded to that with a Health Human Resources plan that has added resources everywhere. Here at Surrey Memorial, with the assistance of Dr. Lee and her team, with the extraordinary staff here at Surrey Memorial Hospital, we've been in the midst of implementing those 30 measures, and we're going to talk about some of them today, but they are laid out in detail for reporters on the phone and for those here as well in the press release that you'll be receiving, the progress on all 30 of those actions. I think significantly, in addition to the very significant work being done on capital, we're breaking ground on the renal center in August. We're starting on this project, and now the significant action on capital, really what the core of a hospital is its people. And so I just want to give you the breakdown of the numbers of the healthcare providers of all kinds, physicians, nurses, and more, providing much needed care to people at Surrey Memorial Hospital. 293 new positions, not existing positions, new positions, have been filled since we announced the 30-point plan. This includes 23 of 27 new pediatric emergency positions have been filled, 21 new resident clinical associates, 4 associate physician positions have been hired at Surrey Memorial Hospital, and 11 additional offers are on the table. 5 new nurse practitioners have been recruited as SMH since January 2023, supporting internal medicine and thoracic and general surgeries. Fraser Health has hired overall at Surrey Memorial Hospital 88 internationally educated nurses and 71 internationally educated physicians. We'll just let that go. We may have some intercom from time to time. From April 2023 to March 2024, 122 new nursing graduates and 164 employed student nurses were hired at Surrey Memorial Hospital. Since April 1, 2024, 23 new nursing grads and 150 new employed student nurses have been hired at Surrey Memorial Hospital. Since 2023, a total of 9 internists have been hired at Surrey Memorial Hospital. This is hundreds of new healthcare workers, examples of the hundreds of new healthcare workers who have been hired to new positions since June of last year in a variety of program areas in the province. This is hundreds of healthcare workers providing care at this hospital who in positions that were not there before. Since last year, we talked about our 30 actions. We've completed 14 of those 30 actions, with all of the remaining 16 in progress. Additional actions have included expanding the internal medicine bed capacity from 30 beds to 90 beds, the implementation of a child and youth mental health emergency response team for Surrey Memorial Hospital and Fraser Health, implementing an expanded overflow waiting area for Surrey Memorial Hospital's pediatric emergency department, opening a new transitional housing space that provides accommodation for people who require a short stay in transitional housing environment, and enhancing Fraser Health's successful in-house learning institute to close critical gaps in allied staff and nursing. More than 50 additional nursing seats have been enrolled to date, and the Health Career Access Program in acute care has expanded to 66 program seats. Capacity at Jim Pattison's outpatient care and surgery center has also increased, including increasing operating hours by 22.5 hours every single week, hiring new physiotherapists and occupational therapists to expand access to patients receiving care in the community, expanding cystoscopy and colposcopy services, enabling an additional 40 to 50 procedures each and every week, enhancing hours at the Orthopedic Cast Plastics Clinic, which now supports an additional 120 patients to receive the care they need every week. The Surrey Satellite Emergency, located at the Wally UPCC, expanded its operations by 3 hours on September 5th, 2023, and since opening in December 2022, has seen over 31,000 patients. In addition, I'm pleased to share that renovations to the Surrey Memorial Hospital Family Birthing Unit are on schedule and are expected to be completed by June 30th. That's this week. Once renovations are complete, the capacity expands from 6 beds to 10 beds, which means that more expecting parents can plan to deliver their babies close to home at Surrey Memorial Hospital. 5 international medicine residents have been allocated to Fraser Health and will begin residency at the Surrey Memorial Clinical Teaching Unit on July 1st, 2024. And of course, we know, and in addition to that, we are adding 4 additional tertiary neonatal beds by June 30th, 2024, that increases the capacity from 6 to 10 beds. And the gynecology out of operating room procedural sedation program has expanded by 1 slate per week, allowing for 8 to 10 additional procedures a week. We are, as you see, delivering on what we said we'd deliver. In each case, promise made, action initiated, action taken. Some of those actions, when it comes to building a new tower or the new renal suite, by definition, take longer. But overall, the key actions, which is hiring more people, hiring more doctors, hiring more nurses, hiring more internationally educated doctors and nurses as well, hiring more care aides and health sciences professionals, improving relational security, improving significantly, and you'll see this in the fuller report, the supports we give to people working on site, mental health supports and others on site, are all significant responses to what we heard. This has been a team effort. I want to thank everybody who's worked on this project together with us here at Surrey Memorial Hospital, this project of improving services, of listening to people and acting on what they told us, which is what's happened continuously over this period. We're very pleased at the results. In short, when you talk about creating new positions, we've created new positions, 414. We've filled 293 of them. And the remaining 121 will be filled in the next short period. In short, this is the action people in Surrey need and deserve. Action on the emergency route, action in specialist care, but mostly more healthcare professionals providing outstanding service in the community. Obviously, I've described this. This is a growing community. It's why we're building and have a second hospital under construction. It's why we're building a new tower here at Surrey Memorial Hospital, why we've added care in the community, including new nurse practitioner-led clinics, primary care networks, urgent and primary care centers, the additional MRI and CT scan capacity that we've created in Surrey, which was neglected for a generation prior to 2017. In short, this has been extraordinary action. I want to thank the teams at Fraser Health and here at Surrey Memorial Hospital for all the work they do. Before I introduce, I think I'll introduce Dr. Lee now, and I'll just have one or two remarks on another issue, another subject when she finishes.
Thank you so much, Minister Dix, and good morning, everyone. Pleasure to be here again after last week's announcement, and in fact, pleasure to be in this room because, as Minister Dix mentioned, there were a lot of meetings and engagement with staff, medical staff of Surrey Memorial Hospital, as well as community services, and those meetings occurred here in a different format, but as we're changing and renovating to get into the cath lab mode. Everything's been cleared up, but a year later, I think Minister has outlined the 30 actions that were not only comprehensive, but also streamlined to deliver increased access in the services that the communities in Surrey, as well as south of Fraser, as well as some of the regional services that we were able to expand. So the commitments that were made to improve services, improve access to not only Surrey Memorial Hospital, but community services, and to improve the conditions that our staff, medical staff, and our teams are working in. We partnered with our community, with our staff, medical staff, to enhance our delivery of services. And I think Minister might agree with me that pace of change sometimes can feel slow in healthcare, but in Surrey, the pace of change has met the growth in terms of how quickly we moved with the 30 actions, whether it's capital, and we have lots of expanded capital services that are coming, but we also want to make sure that we have people that are able to service, and on both ends, we have moved quickly to respond to the challenge of access and listen to our teams and the community to ensure that we're delivering on those services. So expanded hours of services in community base, into surgical services. I think some of those have been already highlighted by the minister, really centered around partnerships, innovation, and creativity and hard work. If we just compare from the past 12 months, we have completed more than 2,000 additional cystoscopy and colposcopy procedures, supported 6,000 additional patients in need of orthopedic care, and provided 400 more women with important gynecological surgeries. I think you might recall hearing about some of those gynecological surgeries and the need for expansion, and that has happened because of the commitment that was made and delivery of services to expand. So I think it's a truly a remarkable story of teamwork. Our teams that are here, our teams that are at the regional level, our community coming together to best support our patients and to ensure that we are not only here for the services of today, but looking at the growth and specialty services and health human resources that we require for that growth. No one person, team, or department has accomplished this alone. We've done it together, and there's still lots of work ahead as we have 16 actions that are not completed yet, but work underway in those. I know that changes that we've made haven't solved all of the challenges, but we are pressing forward to ensure that every single day we're able to actually move forward on not only the 30 actions, but additional commitments that make Surrey a really comprehensive health sciences campus with expanded community services from primary care, long-term care to additional new hospital in Cloverdale, as well as the new acute tower and the medical school. So all of that together is a very comprehensive plan, not only for Surrey today, but for tomorrow. I want to really thank Minister of Health and the government for their unwavering support to today's needs as well as future needs of the community. This area of our region has evolved quite a bit and grown quite a bit since Surrey Memorial Hospital opened 65 years ago. The progress that we're sharing today is ensuring that the hospital and the services around the hospital and the community evolve with the community and will remain at the heart of healthcare that we deliver to the population for decades to come. Thank you so much for joining us today.
Hey, thank you very much, Dr. Lee. And before I conclude, I'll just say a few things about Surrey Memorial Hospital. I want to acknowledge my colleague in the legislature is here, Eleanor Sturco from Surrey South is here, and it's good to see Eleanor here. I just want to say that I think here in Surrey, building a second hospital, building a second cancer center, building the first new medical school in 3 generations, building a new tower here at Surrey Memorial Hospital, adding to primary care, these actions, a cardiac cath lab, which was a significant advance, and is happening right here on this site. We'll be able to share more of this site with you to show where that cath lab and where that new interventional radiology will be. All of the services have been added for mental health and addiction care. And still, as Dr. Lee says, we have a massive and growing population that we are addressing, and we intend to continue to do more. This is 293 new positions in a year at one hospital filled. This is another 121 positions set to be filled, established, funded, in place. Often we talk in announcements, we talk about an announcement that will make one day and happen sometime in the future. We have to build a new project, we have to build out a program. This is action on what people in Surrey wanted to see, what staff at this hospital wanted to see. This is action across the board. Finally, I just want to speak about something that's a little bit different. We've heard news, of course, that my dear friend of a very, very long time and former Premier of British Columbia, John Horgan, has had a new diagnosis of cancer. I understand he's taken a leave as in his new job as ambassador to Germany. John is, of course, a good friend of ours and truly a great British Columbian who has served this province so well. And we know the battles he's gone through with cancer, and we know that he is going to do that again. And just providing all our thoughts and prayers and support to John. I know that everybody who knows John in the province has worked with him feels as I do. I feel a little bit more strongly that I've worked with John and been close friends with him since 1987. It's just our thoughts are with the whole family right now. And with that, I'm happy to take your questions.
Thank you for joining us today. We will take questions now. For media in the room, please come to the microphone stand and state your name and outlet. For media joined via Zoom, please use the raise hand option and we will call your name. Media will be limited to 1 question and 1 follow-up. Any questions in the room? Okay.
Kate Walker, City News.
Hi, Kate.
Hi. You mentioned there were 293 new positions filled. What will it take to fill the remaining, I think it was 121 that are left?
What it says is that that's real action, people on the ground working, and we described some of the areas they're working, but that's doctors and that's nurses, that's health science professionals, that's healthcare workers, that's people supporting them, that's people working in mental health and addictions. And that just shows the progress we've made. That's new positions in a year since that announcement's been made. And so we're continuing to recruit. There's more coming on board, but what we've been doing, and the reason we're doing this, we said we report regularly. I think we last reported about March on this. Since that time, we've gone from, I think it was around 165 hired at that time to 293. So it's the same way by recruiting, and that's what we're actively doing, including, as you'll know, in the United Kingdom, in Ireland, in the United States and other jurisdictions. So we've seen, for example, in internal medicine, the changes they made at the College of Physicians and Surgeons and the recruitment efforts bring people to internal medicine here at Surrey Memorial Hospital. And we're going to continue to do this, not just in Surrey, but of course everywhere. We're very focused here. But across Fraser Health, you're seeing this dramatic increase in demand. And in some areas, it's more evident than in other areas, the challenges you face. But it's across the board. So we have a health human resources plan. Since I've been Minister of Health, there are 45,000 more people working for the healthcare system. And this is, of course, one of those things, because I've been meeting with healthcare workers like I did in Surrey at so far about 36 hospitals. Whenever I say, oh, we've added that many workers, they don't feel that that's happened, because, of course, the number of people in that period has increased now by close to 1 million people in a province that had roughly 4.8 million people beginning. So 1 million is a lot on our population base. And so we're going to keep hiring. We're going to report again in a few months about the success of that hiring and what we've done. But this is a success so far. And what I said to people is, we're going to take these actions, we're going to report on these actions. We've taken these actions, and this is a report on these actions. And we're not leaving out a part. We're not saying, well, there isn't 121 to go, because there is. And the good news that those are funded positions. We just have to fill them, and that's the work we're doing.
Okay. You mentioned you've completed around 14 of the 30, so almost halfway there. What would you say is the biggest challenge when it comes to, finishing this 30-point plan? Is it the time that it takes to build some of these facilities? What would you say to people who are, anxiously awaiting for this to be complete?
Well, you look at the renal center we announced last week. So that won't be completed until it's complete, right? So that, in that case, that'll be completed in 2025. But for a new building, which is, I think, an $86 million capital item, that's a significant construction. 21 new spaces will lead to about 23,000 more procedures. I mean, and so that's one of the actions. That action, by definition, takes longer than other actions, which are filling staffing or improving security or whatever what they might be. So in those cases, in the case of the new tower, we're preparing the business plan. That will take, for that action to be complete, will be the opening of the new tower, and that will be sometime later. So, but I think the key for us is twofold. To provide better services now and in the future, you need more people. And so that's what we've been delivering here, and the staff here do an exceptional job. And again, it sometimes doesn't feel that way, because we also have so many more people to serve, especially in this community. But in the broader region, I mean, Surrey, this hospital serves people in Langley, it serves people in White Rock, it serves people in Delta, it serves lots of people beyond the population growth I described as Surrey. But so some of the actions were going to take longer than this period, but what you're going to get from us is sustained reporting. Where are we and where are we now? There's significant progress on the renal announcement, that's the business plan. There's the groundbreaking. They're going to be breaking ground in August. That on an $86 million capital project that was starting a short time ago is really quite fast. You'll see that on the cardiac cath lab, where you see the emptying out of the space here. That will take similarly some time, because it's a smaller capital project, not an inexpensive one, but a smaller one. And then obviously the big items will take some years from now as well.
Going to the next reporter in the room.
Paul Gill, B-Core TV and Satyadeva's newspaper. My question is for Dr. Lee. Dr. Lee, we're very happy, you're hiring all these new positions, but what is the ratio of people who will be retiring or going on medical leaves or leaving the province that have given their notices already to you, and the increase in the population of 2,000 people per month on a ratio basis, where would we stack up 6 months from now?
Well, Paul, I'll answer. I'll ask Dr. Lee to answer as well. The 293 are the new positions, right? We're also hiring in all the other positions all the time. But we're reporting specifically on the action plan. But BC is gaining health professionals, particularly against jurisdictions such as Alberta. I mean, there's always going to be individuals moving back and forth. We're an open country, that happens all the time. But in the most recent year under CIHI, we added, for example, 6.3% more nurses. Alberta lost registered nurses in that time. We've led the country in the hiring of registered nurses since I've been Minister of Health. We added on the medical side, you talked about people retiring. This is net new in the first 9 months of our payment model with family doctors. 708 family doctors in 9 months, net new, practicing in the province longitudinal family medicine. So we are gaining, but what's also happening, and I think, it's always the case that people are retiring and people are coming, right? That's always the case in any system. But these are net gains. When I talk about 45,000 more people working in the system, that's net since I became Minister of Health. But for all the people working in that system, we also have, as noted, and as we've noted, dramatic increases. So we are, the number of people since Dr. Lee has been the president and CEO of Fraser Health, the number of people in that short time has increased dramatically in that time. And I'll hand over to Victoria to say more.
Sure. Thank you so much, Minister. I believe what you're talking about is not only just the net new and also existing, but how are we actually ensuring that we're able to replace at a faster rate than people that are retiring or changing jobs for whatever reason that might be. And Fraser Health has been quite innovative in our approach. We were the first to redesign some of our services to ensure that we're working to the fullest at the team-based model. We've also been quite productive in having our own institute for learning, so having our growth of LPN to RN type of a model, so that's licensed practice nurses to registered nurses type of model, growing people from RN to specialty nursing like emergency or critical care nursing. So where we saw the opportunity that we need to step in as a health authority to ensure that there's additional education and training within our services, we have done that as well. And we have also reimagined what we do. So those of kind of retirement or reducing workload, we've also brought back. So we've been quite successful in bringing people back to do some of our critical projects, critical work as well. So I think overall, absolutely, we're gaining much more than retirements and changes in positions, as you mentioned. And we're doing that through provincial people plan, which includes recruitment, retention, as well as redesign, as well as reimagining, I think, healthcare of tomorrow as well.
Yeah, I mean, I think fundamentally, the recruitment is excellent. You have to also focus on retention, right? It's why we've had these agreements that we worked on with the doctors of BC, the ones we've been with the BC Nurses Union on nurse ratios to make this the best place to work. That's your best recruitment tool. But people are coming to BC to work in healthcare in unprecedented numbers. And that doesn't mean it's easy in healthcare, because we have a lot of also new people in our system that need to be supported and to be successful. And but I think our teams are doing extremely well, but the challenge continues to grow as well.
Dr. Lee, are you in a position to tell the people of Surrey how many doctors and how many nursing net new positions you have added to the emergency room?
Well, I'll just give you one example, because we went through this in pediatric emergencies. But we can provide more information in detail on Fraser Health about the increases in doctors and nurses, which are significant, which we've reported on before, Paul, on a number of occasions. But you look at, for example, a total of 27 new positions created in the Surrey Memorial Hospital Pediatric Emergency Program Department. 27 new positions, 22 full, for example, that we've described. The additions to the Child and Youth Mental Health Emergency Response Team, they're significant. But happy to provide that information. We've provided it before, and we'll have to provide it to you today.
We are going to Zoom now. We have Katie DeRosa from CBC. Go ahead, please.
Hi, Minister. Thanks for taking my question. There was a court case in Quebec related to medical assistance in dying, and that was brought by the Catholic Church or the Catholic Diocese as a result of legislation in Quebec to stop the practices of not allowing MAID in Catholic hospitals. The Quebec government's decision or legislation was upheld. So there is a precedent for governments, passing legislation to, allow medical assistance in dying in those religious facilities. Is that something that the NDP is considering?
What we're doing, you're talking about St. Paul's Hospital in BC. Obviously, we're building a new St. Paul's, and we're taking action to ensure that people can, as they should be able to in that case, get medical assistance in dying without leaving the hospital facilities. That's going to be provided by Vancouver Coastal Health. And I think that's a positive response that puts patients first. We have consistently acted, make sure people have access to medical assistance in dying in BC, as is their right under the law and is their right as people to make decisions about their own health and their own lives. And so we've taken very specific action, working in partnership with Providence Healthcare and working in partnership with Vancouver Coastal Health to see that happened here. So I appreciate that people want to see a sort of legal response, but my concern is patients and making sure they have access to the care they need, and that's the action we're taking at St. Paul's.
Katie, do you have a follow-up?
Yes, but what about beyond St. Paul's? Because they're of the, denominational health association. There's 12 different, religious organizations that provide hospice care and various type of healthcare around BC. So how does this, how would a decision, how does the situation at St. Paul's affect other religious health organizations that do not provide MAID?
Well, I think what's significant about MAID in acute care, and it's important to say it in acute care, what happens in acute care is that people are often brought to an acute care facility, say by ambulance for whatever circumstance they end up there, and then they may make a decision around medical assistance in dying, and that's why the work we're doing at St. Paul's is so important. People have a right to medical assistance in dying in Canada and in BC. As you know, we've taken strong action, including in Fraser Health, when the issue arose in Delta, to make sure that people have access here. And we're going to continue to ensure that people have access. In fact, I think other than Quebec, people have utilized the medical assistance in dying service more in BC than other places, and that's a tribute to the compassionate care provided by doctors and nurses and others. If you look at the statistics on utilization, it's obviously utilized most on Vancouver Island, and I believe if I remember correctly, least in Fraser Health. These are individual choices made by people. The majority of medical assistance in dying is provided in people's homes, where they're with their family. That is their choice, and that's what they do. We're going to continue to make sure that people have access to this. It is, from my experience, both as a person and as a minister, it's a very important service and to provide, and also on an individual basis, an incredibly moving service when it is provided for people involved. And so I'm going to continue to take the actions we've taken since I've been Minister of Health to make sure that the law is applied and people's right to medical assistance in dying is maintained in BC. Principally, that's at home, and that's the ensuring that people have the services they need. But in particular, an institution like St. Paul's, I think issues legitimately raised, and we responded by ensuring that a great hospital, St. Paul's, run by a great organization, Providence Healthcare, continues to function, but that people get the service that they need and deserve.
Next, we have Amelia Macao from Radio Canada.
Et on fait un rapport aujourd'hui sur ces accidents. 14 de ces accidents ont été entièrement complétés. On a ajouté, donné une nouvelle position, 293 positions à Surrey Memorial Hospital qui sont là actuellement. Il y a 121 nouvelles positions aussi qui restent à remplir, mais on va le faire, je pense, dans les mois à venir. C'est une réussite quand même extraordinaire de la part de la Régie de santé Fraser Health d'ajouter des gens, que ce soit des médecins, des infirmières, des spécialistes de sciences humaines, des travailleurs en matière de santé, des ambulanciers et d'autres. Nous avons vu dans la province une augmentation depuis que je suis le ministre de la Santé de 45 000
travailleurs et professionnels dans le système, ce qui est extraordinaire. Mais on a aussi, pendant cette période, presque 1 million de gens de plus depuis ce temps. Donc, c'est toujours un défi. Mais je pense que ce qu'on a fait ici, avec des actions, et j'ai fait les rapports sur ces actions tous les 3 mois, démontre notre capacité de remplir des positions et de donner à tout le monde l'accès les services de santé dont ils ont besoin. Is that okay, Katie?